So this is in the relapsed refractory setting. As many know, Gilteritinib has a indication in much of the world for the relapsed refractory setting. If you get a patient in remission, you want to move them to allotransplant if possible. And the obvious, we've just talked about post-transplant maintenance with the drug. You want to continue the drug after transplant. Is there a benefit to this? Well, many patients who were bridged to transplant did resume the drug. And while it was not a re-randomization, as regulatory authorities would like, it does provide evidence that there's a clear benefit to resuming the drug post-transplant as expected. So this is just sort of data that reassures practitioners there's some evidence that you should resume the drug after transplant.